physician, we are taught to be strong, but it becomes emotionally overwhelming when you're taking care of dying patients, providing support to the families who cannot see their loved ones, and going through the pain of losing many young lives.
Each year, my colleagues and I, we see daily impacts of the several peaks of malnutrition and malaria on children in community, and it is so hard. So I think that it is important to work closely with the community.
I know for me personally, this is different than my experience in responding to the Ebola outbreak in West Africa. In that situation, I thought a lot about the risk to myself personally in a situation with high mortality. I think this situation is different because I know I don't have the option of necessarily insulating my family from the associated risk because of the kind of work that I do.
I've been separated from my family and my loved ones. Put on top of a national and potentially global recession, we all need to see and understand that our environment has gotten more anxiety-inducing. Once we accept this new baseline, we can each start to take the time and make active changes in perspective that will help us cope.
The fear of running out of PPE, the fear of facing the death of a colleague, several of which has already happened, not even being able to attend the funeral because of COVID, and also this feeling of hopelessness in many of the cases that have come in, because no matter what we do, how we try to oxygenate them, we're unable. And the lack of success over time repeatedly can be very demoralizing.
You're watching the stream. I'm Femi OK. We asked medical professionals around the world, how are you doing? And what you heard is what they told us. So today we are focusing on medical professionals on the front lines of the coronavirus pandemic and the emotional fallout that they're experiencing. The reason we're doing that, let me show you this tweet here from Mr. Ekeji, part of our online community. And he says another group of people whose mental health could be affected are healthcare workers, those in the front line who spend hours, even days, trying to tackle this disease. I pray we emerge stronger after all these. That was his suggestion for a discussion that we should have. Thank you, Mr. Ekeji. We're about to have that discussion. If you're online and you're watching and streaming via YouTube, jump in the comments section and we will try our best to put your comments into this show. Let me get the guests to introduce themselves. Hello, Dr. Salas. Tell everybody who you are.
Hi, I'm Arga Von Salas. I'm a scholar in residence at Stanford University School of Medicine. I also recently spent 2 weeks volunteering in an intensive care unit in New York City.
Good to have you. Hello, Dr. West. Welcome to the stream. Tell everybody who you are.
Hello, I'm Colin West. I'm a professor of medicine, medical education, and biostatistics at the Mayo Clinic, and I've been working on physician well-being research for more than 15 years.
Good to have you. And Dr. Ahmed Twaj makes a return visit to the stream. Good to have you back, Ahmed. Tell us who you are. Remind our audience.
Thanks for having me back. I'm a doctor working in intensive care and emergency medicine in London, but I'm also a journalist.
Can I show this to you, Ahmed? And it's from one of our online community, and they knew that we were talking about you and your fellow professionals and colleagues around the world. And
just
this,
so you guys know, I can't hear the other guests. This is Dr. West.
Heartbreaking. No one cares about carers. That's the message I am hearing. How do you feel?
I think there's been overwhelming support from the wider public, the community, as to what's going on with doctors and nurses as well, in terms of the pressures that we're under. But unfortunately, that support from an outside doesn't actually sometimes reflect to what's happening in reality, because we are suffering in terms of the hours that we're working, the patient seeing, the emotional trauma of seeing patients who shouldn't really be dying in any other situation, who are passing away, and not really being able to do that. So that kind of reflection is something that we really need to consider into how we can help support each other as doctors, as medical professionals.
There's some really disturbing headlines, Dr. West, about psychological trauma. We've seen pictures of people in intensive care units looking incredibly distressed. Their colleagues are going into intensive care, some of their family members, their friends. You've been studying the stress that medical professionals are under for some while now. Could you have predicted what would happen in something like a global pandemic to our medical professionals?
Absolutely. And I think this is one of the features that we're dealing with, is that this has all occurred on a baseline of some trouble in the medical profession. This is an amazing profession. All healthcare workers are engaged in this deeply meaningful activity, helping patients, their families, their communities live better lives. The challenge with the pandemic is that the stressors that were leading to challenges even before the pandemic don't go away. But then, as we just heard, there are these additional stressors that can be overwhelming. Doctors, other healthcare professionals are highly trained to deal with stressful situations. It's sad, but we deal with suffering, we deal with deaths. What the pandemic brings, though, is a magnitude that is different than what almost any other healthcare professional has had to deal with. But I think with that baseline that was well recognized, the fact that those pandemic-related stressors would hit us in such a deeply emotional way, I think was predictable.
Mm-hmm. Argavan, you were on the sidelines when the pandemic hit the United States, and that didn't sit well with you, so you volunteered. Can you take us into the thinking of why you volunteered when you knew it was going to be terrible? And then what did you see?
Sure. So I, as you mentioned, I'm in this role, which is a non-clinical role as a scholar in residence, so I don't currently see patients. And when the pandemic hit the United States, I really felt a deep sense of guilt that I wasn't caring for patients and not on the front lines, and really wanted to help. So I looked into ways of volunteering locally here in California, where I live. And luckily, we sheltered in place very early here and didn't end up having the big stressors to the healthcare system here that have happened in other places like New York and Detroit and Chicago. So to me, it was kind of a no-brainer that I wanted to help. I needed to be able to go to one of those places. And so I decided to volunteer in New York.
And how did people manage? How did they cope with the stress of a global pandemic where people were dying? And certainly for New York, the figures went up and up and up and up, and only now are beginning to stabilize somewhat in terms of the people passing away.
Yeah, it was a very challenging situation to walk into, but I always try to emphasize that as a volunteer, I chose to go there, and I was only there for a limited amount of time and could leave basically whenever I wanted to, which is a pretty different mental space to inhabit from the people who live and work there and had this all drop in their laps. And they really have no choice but to show up every single day and try to take care of patients. And as was described in the package, one of the things that's really challenging is when the people who get really sick from coronavirus, it's almost like we can't help them. Like we only have a limited set of tools, which are, our ventilators and antibiotics and other medications, typical critical care that we provide. And they just seem to be insufficient in this situation. Sometimes we can't get enough oxygen in their lungs. Sometimes we can't get enough carbon dioxide out of their lungs. Their kidneys start to fail. And then we're left in this position where we as helpers, as people who like to solve problems, find ourselves without the tools that we need to solve this problem. And then we see people dying day after day. So I was there for 2 weeks. And in the entire time that I was there was one patient who left the ICU and went to a different part of the hospital because he was well. Every other patient who left went to the morgue.
Dr. Twage, Ahmed, I'm just looking at your face right now. And if I could just read your face, it's just pure exhaustion. But in terms of your mood, what's your mood? How are you doing?
I think it's, in terms of my mood, I'm able to kind of de-stress when I do get home and unpackage it. But in terms of the exhaustion, it exists. The hours are long, and it's just kind of go to work, get home, sleep, go back to work, and it's just kind of like a repeat cycle. especially at the peak times when that was literally the most intense, I guess, periods of, and I've worked across the world before, and so seeing it here in London that this bad, it was quite an intense period. So in terms of the mood, for me, I've been able to manifest it. It's the mood when you're working is when it's really difficult. So some of the patients that you're seeing who you can't even get their families to come visit them, and they're just sat there dying alone, and they sometimes can't even grasp how unwell they are. They feel like that they're well, and you're telling them that there may be a chance that they're going to die in the next few days. They can't really grasp that, and that's what's really strange about this disease as well. I remember one patient he was an elderly gentleman, and I had to call his wife to tell him that and this is something that really kind of got to me, and they'd been married for 60 odd years, and I had to tell her that he was going to pass away and she was never going to be able to see him. And she just sat there crying on the phone. Normally these patients saw them face to face, give them a tissue, like put your hand on their shoulder, something like that. This patient was just crying on the phone, and I had literally nothing I could say or do in that situation, and that really just took a toll on me at the time.
Mm-hmm. Doctors, let me put this up to all of you, because there's some conversation on YouTube right now. So Naitran says, as watching all of you doctors, are there plans to have periodic psychological exams during the crisis? Dr. West, do you want to handle that? Have you heard that? Have you seen that? Is that available to anybody?
Yeah, so I think from a formal standpoint, I'm not aware of sort of mandated psychological assessments. That said, I think what we're talking about here are some of the unique features of this virus and this pandemic in isolating people and patients and healthcare workers in the midst of a really severe illness. And so whether it's formal or informal, I think there certainly is discussion about how do we restore that sense of community, that sense of connection for our healthcare teams. Medicine's a team sport. So as we're being pulled apart, as we're hiding behind personal protective equipment, as we're maintaining physical distancing, how do we ourselves maintain a sense of connection, that sense of social connection? And so if that's informal, that's wonderful. For more serious sorts of events, the suffering, the dealing with waves of death and the uncertainty that's being described, more formal processes may definitely be helpful. There are some hospitals that are talking about, debriefing sessions after shifts or after particular traumatic events, with the idea being that rather than internalizing these and allowing them to fester, we can try and share those experiences and bear some of the burden together. But ultimately, this is about the environment and how do we sustain ourselves and our colleagues within an environment that's filled with so much uncertainty, so much suffering, bring our skill sets to bear to be able to help our patients and do what's so meaningful to us as well.
There's a lot of empathy online, doctors, from you. Yeah, Agavang, please go ahead.
I just wanted to comment one thing, which is that I've seen a number of centers, medical centers, that have added after-hours psychiatric care that's available or therapy that's available. And I think that's a great first step. But one of the challenges that I saw when I was in New York was that the doctors were working such long hours that when they went home, they really were not, the last thing they needed was to talk to someone on the phone about what they'd experienced at work. What they needed was time away from work. And so if we could figure out a way to incorporate those types of sessions into the workday, I think that would be more manageable for people. It would be logistically challenging, but I think it would be better than asking people to spend their nights and weekends reflecting back on all the trauma they've witnessed.
I agree completely. That's an excellent point.
Let me bring in Dr. Kinjal Goyal. She is a psychotherapist, and we asked her about this idea of the emotional fallout of medical professionals. This is what she told us.
My greatest insight from working with doctors during the pandemic has been that we need to stop calling them warriors and gods and alienating them from the rest of us. By placing them on a pedestal, we make it impossible for them to feel or address their own anxieties and fears. We need to assimilate them as part of the same society that we belong to and allow them to feel low, sad, scared at any time, and to be able to offer them the same help that we expect for ourselves.
Okay, healthcare heroes, healthcare warriors. Are you sick and tired of those titles? Argavan, you start first. I'm actually even looking at an article that you wrote. Healthcare workers aren't just heroes, we're also scared and exposed. Telling some truth telling here. Argavan, continue. Are you sick of the way that you're
Yeah.
being characterized? Because you're getting a lot of love on YouTube as well. I have to say, people are really admiring you and thanking you, etc., etc. And you say back to them, what?
Oh, I say first of all, I am not a hero. I really don't think of myself that way. And I don't think, as I wrote with Dr. Jesse Gold in that piece, I don't think it helps us. I totally agree with the person that you had commenting there. When we call doctors heroes or healthcare workers heroes, we're making it difficult for them to have space to express their emotions and to admit fear and anger and sadness. And we can't cope with everything that we're seeing if we're not allowed to express emotions. I think we're doing a job that we've been trained to do in very difficult circumstances, but that doesn't mean that that's what we wanted to be doing. You know, I volunteered, that was my choice, but many other healthcare workers are just thrust into a difficult situation. And I think we need to respect and acknowledge that.
Dr. Twage?
Yeah, I think she's made a very interesting point, because it's not the essence of being as heroes, because that puts an extra added pressure and burden on you. We are just doing our job, but the problem with having that burden is that doctors almost feel like that they have to kind of take a step up, and they volunteer to do more shifts and all that stuff. The reality is that should be the government's responsibility. Why are there so many job vacancies for doctors? Why do we have a lack of funding for our healthcare systems and hospitals? Why are there so many gaps in the rota? That shouldn't be the case. Doctors shouldn't be having to do extra hours. They shouldn't be working 12-hour days for 7 days a week. Those gaps should have been filled, and that's a government problem, not a doctor's problem. So that packaging doctors as heroes adds that extra pressure, and they do end up stepping up and kind of almost forget that we are also human. We do need our rest breaks. We do need our time off, just like everybody else.
Yeah, I think another key point.
If I could just.
Yeah, I'm sorry, Dr. Salas. I was just going to say
go
another
ahead.
key point around this is so much of the issues with the balance between distress and well-being in healthcare professions has been around the stigma that's associated with admitting that there might be stressors that we sometimes need help with. And it's also news to some doctors, by the way, that they're human. They don't like to admit that sometimes. And so I think the more that we separate our healthcare workers, and not just doctors, our nurses, our custodial staff, our cafeteria workers who are also taking personal risks being involved in these pandemic environments to serve others, the more we separate those individuals and suggest that they're different than other humans who are dealing with the same societal stressors and anxieties, the more difficult it becomes for us to allow those people the space, as Dr. Salas mentioned, to process what's going on.
Something curious but expected, certainly when we've got US commenters on YouTube, is that some people don't believe there's a global pandemic happening. Some people are skeptical, and then you're having to deal, as well as having to deal with the healthcare issues and treating people, you're having to deal with things like this. Let me show you. This is what Chase Woodruff posted, and he was looking at healthcare workers out on the street. These particular ones were in Denver, reminding people why they should stay at home and pay attention to the stay-at-home mandates and not be asking to go out, go to the gym, go to clubs, go back to work. So there's this added pressure of, can I call it politics, common sense, lack of common sense? I don't even know how to frame it. Argavan, you're in the States. How do you understand what is happening with that pressure on healthcare workers as well as the pandemic?
Yeah, I think it's so hard, especially in places that have been hard hit. The healthcare teams have really been traumatized by the volume of death and dying that they've seen, and the loneliness that they've seen with their patients, and everything that was described earlier with the phone calls and trying to video chat with patients' families. It's really traumatizing. I think that is the best word for it. And then when you see in the streets, that there are people gathering. A couple of weeks ago, there were massive protests about the shelter-in-place orders. And all I was thinking about, I'm sure like many of us, was, oh my gosh, how many people are now going to be infected because they were just at this protest? And then how much strain is there going to be on the healthcare system as they trickle in to get their care? And are we going to have enough of everything we need to take care of those people? And it's almost like putting salt in a wound. We're already really struggling to keep up and to do the best that we can in a limited resource setting. And then people are saying that we're making it up. People have accused doctors of creating the coronavirus so that we could, I don't know what. I mean, who would want this? Who would want to see people dying every single day? I would say literally none of us. It's absurd.
I want to bring into the conversation Dr. Peter Liu. He's a surgical resident at New York Presbyterian and Columbia University. He's a pretty mean piano player as well. And the doctors and the nurses and the healthcare workers at New York Presbyterian and Columbia University, they're using music as a healing element. Let's have a listen to what he's up to.
Some of our colleagues and loved ones have become our own patients. In the midst of these unpredictable and difficult days, a few of us have found comfort in the unifying and healing power of music. So we organize these concerts to share some of that music with our patients and colleagues in hopes that it might offer the comfort that is so desperately needed.
I really want you to see what this looks like when staff are helping each other. So this is Dr. Cato, who until recently was on a ventilator. He's still having trouble breathing, but apparently he's having no trouble singing. Have a listen, have a look.
Shining, shimmering, splendid, delving princess, and when did you let your heart decide? I can open your eyes, take you wonder by wonder, over sideways and under.
Dr. Tuage, the reason why Dr. Cato was singing A Whole New World was because he was so close to passing away, and he's now existing in this whole new world of having to fight the coronavirus. And that was why he sang that song. It's really hard not to well up when you watch that. What do you do? What do you and your colleagues do to keep well, to stay sane, to look after yourselves?
I think there's little things that are really positive for us to be able to do in terms of clinical practice. Those few patients, like was previously mentioned, very few end up leaving the ICU. But those that do eventually leave, the nurses, I've seen them, they do like a guard of honor and they clap the patient out. And those little moments where you can see some sort of positive light at the end of the tunnel for these patients, it does motivate you to keep going further with the other patients, because some of them do turn around, and that's what it's difficult to predict which patients will turn around, but some of them do. So those little moments of, I guess, positivity is something that's nice. Unfortunately, there have been a lot of political commentators in the UK. One of them is Katie Hopkins, for example. She's actually, for those videos like the one that you've just shown, would insult doctors and nurses, saying, why are you wasting time in hospitals and singing songs and making dancing videos when you should be treating patients? And the reality
Dr.
is those
Twade,
videos...
do you know what? I'm so glad you mentioned that, because we've had those comments also on YouTube, and people are like, well, you can't be that badly off because you're singing and you're dancing and you're doing TikTok videos.
Yeah, exactly. So those kind of comments that are coming are not only disrespectful, because it would suggest that doctors and nurses aren't putting their best efforts to treating patients, but also demotivating, because at the end of the day, they're doing these videos to almost celebrate how we are progressing and how we are trying to strive to do our best. And those little positive moments are what motivates doctors and nurses to keep going. And it's a team process, just like you would in any other profession where you do team building exercises. That this is one of them.
Dr. West, I've got one.
I could just make a quick comment
right at the very end of the show. So make it one sentence, but make it count. I know you will. Go ahead.
I was just going to say those videos celebrate our shared humanity, and it's hard for me to understand people who would tear that down.
Oh, beautifully said. I'm not being very partial there, but thank you so much for being on the show. Dr. Salas, Dr. West, Dr. Twaj, and then let me just tell you what some of our audience are saying. Thank you so much from French Vanilla on YouTube. To all the frontliners all over the world, may you stay healthy and fit, not only physically, but also mentally. Last word to you, the community. Our community shows continue in the next episode of The Stream. Thanks, everybody. See you next time.